Welcome back again here at our wonderful program. And as promised, we took a short break and we had already introduced our discussion for today on panic disorder. And our next discussion, or the question at hand, was how to differentiate, of which Daktari was able to do so. And now we are going to ask on at what point does repeated panic attacks become a disorder? Can we just have a short recap, maybe for those who are currently joining us, on what is panic disorder? How do you differentiate it from the normal panic attacks? And then how does repeated attacks lead to, unfortunately, the clinical disorder of panic disorder?
Thank you so much.
Yes.
Shaila. Good question.
Mm-hmm.
So, for us to say you have a panic disorder,
Yes.
and then this is a repeated and unexpected fear that has been creeping you repeatedly.
Okay.
It lasts even up to 20 minutes.
Yes.
And this is something that has not just happened,
Mm-hmm.
but it has been happening
Yes.
for beyond 1 month,
Mm-hmm.
2 months, and so on.
All right.
The normal fear is always having a reason or a cause.
Mm-hmm.
For example, a person can be worried because of exams for the students we deal with.
Yes.
And then the normal life, somebody can be worried because of probably a snake. You can see a snake
Mhm.
and you jump up.
Yes.
You can maybe
Uh-huh.
be in the house and you feel like there is a witch.
Mhm.
Somebody outside
Someone,
there
someone
at
behind
night,
you.
you know.
Uh-huh.
And sometimes even when you see these wild animals, you get fear.
Yes.
So there is a cause of that fear.
Mm-hmm.
But panic disorder, this
Mhm.
one has been there repeatedly.
Mm-hmm.
And at times it's like a flashback. You remember what you went through and it creeps you.
Mm-hmm.
All right? And so it is repeated and persistent.
Repeated and persistent.
Correct.
Mm-hmm.
And in most cases, it is unexpected.
Mm-hmm.
So it happens without your expectations sometimes.
Okay.
Yep.
All right.
Yeah.
That is quite interesting, and thank you so much. Now, when we are talking about the common, how common then is panic disorder, and who unfortunately are at more risk of experiencing this? In terms of when we are saying that this is something that is repeated, it means it has occurred time and time again. And as we dive deep into this wonderful discussion, I hope as our viewers, you are making sure that you are telling us which questions you have in regards to panic disorder and maybe panic attacks. Maybe you're experiencing a panic attack and you think it's a disorder, or maybe it is indeed a disorder and you did not know. So, Daktari,
Yes.
how common is now panic disorder, and who are at most risk? Yes.
All right. Panic disorder is common,
Mhm.
especially in youths.
Yes.
Remember,
In youth.
youth, yes.
Okay.
Vijana.
Mhm.
Okay, yeah, vijana.
Absolutely.
Yeah. So one of the reasons why it's common in youth is because youths are still developing.
Yes.
The mind is still developing,
Mm-hmm.
and now they are learning new things in life. And when we will be diving deeper into causes, you realize that one of the causes or the risk factor
Mm-hmm.
for a person to develop this panic disorder
Yes.
is life or social situation. For example,
Mm-hmm.
parents who divorce,
All right.
all right,
Mm-hmm.
and they leave a child with one parent.
Yes.
Number two, can it be traumatic experience or event
All
a
right.
child goes through?
Mm-hmm.
Violence is one of the traumatic stress challenges that people go through.
Mm-hmm.
And in most cases, it affects more youths than adults. Why? Because these youths end up being tormented, thinking on life, how will life be tomorrow?
Mm-hmm.
How will be their future
Yes.
without the father, without the mother?
Mm-hmm.
And eventually they end up
Mm-hmm.
developing that fear persistently.
Yes.
And so when it is persistent at that point, becoming repeatedly facing it,
Mm-hmm.
then eventually it develops into a disorder now.
Yes.
Because it is now beyond your control.
Mm-hmm.
You cannot control it, and so it comes unexpectedly.
Absolutely.
Correct.
All right.
And then the other reason why it is also common in youth is because youths have no place to stay unless they stay at home.
Mm-hmm.
they only depend on parents and everything.
Yes.
So they also become worried
Mhm.
if their parents are not together.
Mhm.
And so they think that life has come to an end.
Mhm.
So with that in mind,
Yes.
they continue to remain in fear
Mhm.
for a longer time,
Okay.
not knowing what their future holds.
Yes.
Correct.
All right. That is quite interesting and quite unfortunate. And now, because we have been able to now get an understanding of basically what panic disorder is, we're moving on to symptoms. What are the main symptoms of panic disorder there?
There are so many signs and symptoms,
Mhm.
Jadida, that people show up with.
Okay.
One of the most commonest one is
Mhm.
increased heart rate.
Increased
We
heart
call
rate.
it palpitations.
Okay.
You realize this person will have increased heart rate, the heart is beating so fast.
Mm-hmm.
They feel as if they are about to face a bad situation.
Yes.
They end up sweating,
Mm-hmm.
severe headache.
Okay.
Some of them they even vomit.
Oh.
Yeah. And then others, you realize they'll start having tremors,
Mhm.
trembling,
Yes.
and the feet will also be trembling with the upper limbs.
Mm-hmm.
And others will end up having high, breathing high, very fast.
Mm-hmm.
Fast breathing, right?
Yes.
Yeah. And then the other one is you will realize that this person will be unsettled or restlessness.
Mm-hmm.
A person cannot concentrate, they lose
Mhm.
concentration. Others will appear as if they are lacking something, they are
Okay.
not complete. You
Mm-hmm.
get the point.
Yes.
And then the other thing that also you will see in these people
Mm-hmm.
is that some of them will not connect dots. I don't know if you understand connecting dots.
I'm trying to.
They cannot figure out exactly what is happening, so they like in a dilemma or
Mhm.
something.
Okay.
And at times,
Mhm.
some of them end up having general body malaise. They just become weak.
Mm-hmm.
All right,
Yes.
they can't run sometimes, and some will run very
Mhm.
fast. And then some other people, you realize that they will end up being somehow confused, but not really confused.
Mm-hmm.
But they appear as if they are confused, but they are not really confused. The other thing that you'll see again is that these people, at one point, you realize that they can go silent when they are talking with them.
Silent.
They remain quiet,
Okay.
as if they are concentrating on something.
Mm-hmm.
But in a real sense, that fear has gripped them.
Oh, okay.
Yes.
All right.
Yeah.
Those are quite interesting signs and symptoms. And some are things that I didn't know that were signs and symptoms.
Mhm.
And when we're talking about these signs and symptoms,
Mm.
can they be confused, or can this disorder, that is panic disorder, be confused with other conditions, such as maybe heart problem or asthma?
Correct.
Yes.
Yeah. You see, when you talk about by their signs, it's what
Mhm.
we see in a person. We
Yes.
see trembling as a sign,
Mm-hmm.
but nausea is not a sign. It's
Okay.
a symptom.
Mm-hmm.
The person will tell you, "I feel like vomiting,"
Yes.
but when they vomit, it's not a sign.
Mhm.
You see it is vomiting.
Okay.
So signs is what we see. Now, what makes a difference between them having developed heart problem and,
Maybe asthma.
for example, asthma?
Mm-hmm.
And by the way, before even I dive deeper,
Mm-hmm.
these patients with panic disorder, for those who are asthmatic,
Yes.
they will easily fall into a crisis.
All right.
That's to say that they can end up having asthmatic attack at that
Mhm.
time.
Mm-hmm.
Because when somebody is fearful, the body always responds.
Mm-hmm.
The body is a machine, a complete machine.
Yes.
So the way the body responds,
Mm-hmm.
it releases what we call cortisol hormone,
Okay.
commonly known as stress hormone.
All right.
Now, the effect of stress hormone is
Mhm.
that it causes vasoconstriction. And when it causes vasoconstriction,
Mm-hmm.
and of course it spreads within the body,
Mm-hmm.
when it reaches within the lungs,
Yes.
it causes that vasoconstriction within the lungs.
Mm-hmm.
So a patient will develop wheeze and will have difficulty in breathing.
Mm-hmm.
And so they will fall into a crisis of asthmatic
Mhm.
attack. So it can be worse to them, those
Mhm.
who are already having these cases of asthma.
Mm-hmm.
But for those who don't have asthmatic attacks, or those who don't have cases of asthma,
Mm-hmm.
they will only have difficulty in fast breathing, for example, because now they'll be gasping for more air to supply within the vital organs of the body.
Mm-hmm.
And that one will happen after some time. It will take a period of a few minutes.
Yes.
Later on, they will come back to normalcy.
Mm-hmm.
So it cannot be asthma attack just because it's repeated,
Yes.
unless it is a genetical case. For
Mhm.
example, if your family members have asthma,
Mm-hmm.
it can also spread to you as an individual.
No.
But this panic attack cannot cause asthma.
Okay.
That should be a difference.
Mm-hmm.
Because asthma is genetical
Mhm.
in the sense.
Mm-hmm.
And then also remember, people who develop asthma, which is not genetical, not always genetical, by the
Mm-hmm.
way, there is a certain age that you can develop that.
All right.
You cannot develop it in adulthood. You can only develop especially in youthful
Mhm.
age.
Yes.
And you see now, so asthma has allergen.
Mm-hmm.
Allergen is the cause of that crisis.
Yes.
If you are asthmatic to, maybe you are allergic to dust, you're
Mhm.
allergic to cold, you're allergic to pollen grains.
Pollen. Mm-hmm.
Yeah, anything that can trigger that allergic reaction is allergen.
Yes.
So for those who have asthma can be worse,
Mm-hmm.
worse than those who don't have asthma.
All right.
But still you can develop a wheeze.
Mm-hmm.
Yes, when you are in
Okay.
a panic mode.
That is quite interesting, and
Yeah.
thank you so much for explaining that in much details.
Yeah.
And I think you've been able to cover majority of the questions in terms of now our next questions, which were under causes and triggers. And on that, they were basically the common triggers of panic attacks and disorder. Are there common triggers aside from maybe animals, or is just anything that someone fears, basically?
Yeah, correct. Yeah. Panic attack, as I
Mhm.
said earlier, has risk factors
Mhm.
that we attribute to it.
Okay.
One of them is traumatic event.
Mm-hmm.
For example, a person who has ever involved in an accident
Mm-hmm.
will always have that fear when they board the vehicle.
Absolutely.
And
Mhm.
the persistent fear sometimes causes panic disorder.
All right.
The other thing can be due to, as I said, social issues.
Mm-hmm.
A family that has divorced or separated causes panic issues in children.
Mm-hmm.
Now, the children will not always feel good to see a father or a mother separate from each other.
Yes.
They'll always wish that they all stay together.
Mm-hmm.
But in an unfortunate event where they separate,
Mm-hmm.
most of the children are affected, and that thing causes fear in them,
Yes.
leading to persistent, unexpected fear,
Mm-hmm.
which results to panic disorder.
Mm-hmm.
The other thing can be due to sometimes we categorize under post-traumatic. I've talked about traumatic event. We categorize under genetical.
Yes.
People who are having this panic disorder in their familial lineage
Mm-hmm.
can also pass it to their offsprings.
Really?
Correct.
So if someone is having a wait
As a disorder.
as a disorder, someone
Yes.
can pass it to their children.
Correct. Let me tell you, my dear friend.
Uh-huh.
People who are having these mental health disorders generally,
Mm-hmm.
it becomes a gene,
Mm-hmm.
and it passes over to the generations. It becomes a generation issue.
If it's not dealt with, or
Definitely, if it is not dealt with, and it's probably still recurrent in that
Okay.
cycle.
okay.
And that's why you realize that people
Mhm.
with schizophrenia
Mm-hmm.
end up having these problems within their lineage
Okay.
if it's not properly dealt with.
Mm-hmm.
So at one point it becomes a genetical thing.
All right.
And being a genetical now, it poses a high risk
Mm-hmm.
that if your father or your mother had this problem, then there's high chances your child will have it.
Interesting.
Yeah.
Yes. Wow. I think we are getting to learn more on this, and we are going to try and stop using that word panic. I'm panicking, but all in all, thank you so much, Daktari, for that. I think you've been able to elaborate very easily on the causes, the triggers, and before maybe we take a short break, I would like to ask this last question under causes and triggers. And the question is more on about lifestyle. Like, how does lifestyle, like caffeine, lack of sleep, or even substance use affect panic disorder?
All right.
Yes.
So lack of sleep and lifestyle.
Yes.
Let's start with lifestyle.
All right.
In this sense, we're talking about how somebody takes care of him or herself.
Mm-hmm.
But now there are people who normally smoke.
All right.
There are those who abuse drugs,
Mm-hmm.
and there are those who use caffeine
Yes.
and all that.
Mm-hmm.
Now, it has been confirmed that people who abuse drugs,
Mm-hmm.
and those who are using excessive caffeine,
Yes. Excessive caffeine.
correct,
Uh-huh.
it can lead to develop
Mhm.
panic disorder.
All right.
And probably just to try to explain this how it can happen.
Mm-hmm.
Caffeine has an effect to your body, right?
Yes.
It's a stimulant.
Mm-hmm.
Being a stimulant, at one point, it can cause palpitations.
All right.
So when it causes repeated palpitations,
Mm-hmm.
it can lead to panic disorder.
All right.
And learn the word repeated.
Repeated.
palpitations.
Yes.
Number two, when you abuse these drugs, some drugs also causes palpitations,
Mm-hmm.
especially this bang
Mm-hmm.
and the likes.
Yes.
So persistent use
Mm-hmm.
can lead to repeated palpitations,
Mm-hmm.
which eventually can result into panic disorder.
Yes.
And then the other kind of lifestyle we're talking about in this case is actually smoke.
Okay.
For example,
Mm-hmm.
people who are smoking bang,
Mm-hmm.
and of course, it becomes like their lifestyle. I know of some people who will tell you
Mm-hmm.
without smoking they cannot work,
Mm-hmm.
without doing it they cannot do this and this. So when they continue using it,
Mm-hmm.
it causes an effect to their body.
Yes.
And one of the effects, as we have talked about, is that the increased use leads to increased heart rate,
Mm-hmm.
which will be persistently lead to panic disorder. Caffeine, I've talked about.
Mm-hmm.
It is a stimulant.
Mm-hmm.
And being a stimulant,
Mm-hmm.
it can as well result in panic disorder.
Absolutely.
Yeah. Something else to note,
Mm-hmm.
people who are always stressful,
Mm-hmm. Stressful.
so they lead stressful lives,
Mm-hmm.
can also develop eventually panic disorder.
All right.
Yes.
That is quite interesting, and thank you so much, Daktari, for that explanation. And the question that comes into mind is, what are the main treatments of panic disorder there?
All right. Thank you so much.
Mm-hmm.
Panic disorder, as it is
Mm-hmm.
a disorder,
Yes.
is actually managed with the
Mhm.
treatment.
Okay.
And we have two lines of treatment.
Mm-hmm.
The first one is psychotherapy treatment.
Mm-hmm.
That is cognitive behavioral therapy.
Mm-hmm.
This is whereby a patient is taken through the challenges they face and to ensure that that fear gets off them.
Mm-hmm.
So they need to be relaxed. So it's a drug that will help you to relax, to
Mm-hmm.
get out of that situation of fear
Yes.
and just be a relaxed person with a relaxed mind.
Mm-hmm.
And then the last one is lifestyle. It's
Mhm.
also part of treatment or management.
All right.
Now, for the lifestyle, we
Mhm.
always encourage patients to have regular exercise.
Mm-hmm.
You have to wake up within your time,
Mhm.
normally do, and do some exercise that
Okay.
morning. You can run if you
Mhm.
love running. You can swim if you like swimming.
Uh-huh.
And of course, you can dance. It's part of an exercise.
Okay.
But we more so always tell patients to do what they love doing.
Mm-hmm.
If you love playing football, well
Go
and good,
ahead.
go and play.
Uh-huh.
If you love running, please do.
Mm-hmm.
If you like dancing, please dance.
Mm-hmm.
Yeah, but okay, yeah. I don't want to say in a good style, but dance the way you know. As long as you're doing some exercise.
Mm-hmm.
Now, this exercise should be regular exercise.
Okay.
You can do it in the evening.
Mm-hmm.
You can do it in the morning.
Mm-hmm.
Number two is breathing exercise.
All right.
I always encourage our patients when they face this fear,
Mm-hmm.
that they should have that time to breathe in and breathe out.
Yes.
And we have these breathing techniques.
Mhm.
You remember we discussed sometimes back.
Yes, you
I
did.
don't want to go deeper into that.
Mm-hmm.
But when you do that breathing techniques, it relaxes your mind and helps you to reduce that level of fear.
Mm-hmm.
It might not clear it all, but at least it can reduce to a certain percentage.
All right.
The other thing is about having what we call sharing. Be willing to share what you go through.
Mm-hmm.
Sharing is I have solved.
Yes.
So sometimes when you have a problem and you share, it's slightly half solved.
Okay.
So we always encourage your patients
Mm-hmm.
to share the stories, to be able to have that opportunity to learn from others also.
Mm-hmm.
Because sometimes you may think that you are the only one facing the task or the challenge, only to discover that there are other people who have gone through that
Mm-hmm.
and have managed to be where
Yes.
they are today. So there is nothing new in the world. That's what I know.
Mm-hmm.
That everything happening has ever happened before.
Yes.
Yes.
Okay. That is quite interesting, and thank you so much for that,
Yeah.
and for telling us on how to just navigate this in aspect of also even lifestyle changes there. And when we're talking now about still under treatment, is this treatment something that will be fully cured, or like the disorder, will it be fully cured, or it's something that someone has to manage for a long time, like how someone
Pressures
manages
are-
diabetes or
Oh.
pressure, hypertension
Mm.
there? Yes.
You're right. Thank you so much. Panic disorder is treatable. Once you're treated, you can come out of it fully.
Mm-hmm.
So you can recover fully from panic disorder.
Yes.
It's not like these non-communicable diseases.
Mm-hmm.
It is something that can be treated and can get out of it.
Mm-hmm.
Treated and managed.
Mm-hmm.
Yeah.
Okay.
Yeah. So you should not be worried when you have it. Just come. Just come to
They
the
should
hospital.
come to the hospital.
Correct.
Okay.
Come to our hospital and we will be able to attend to you.
Mm-hmm.
And of course, we will be able to help you to ensure that you lead your good life.
Mm-hmm.
Yeah. You know very well that, just before you say it, you know very well that this panic disorder will
Mhm.
always deteriorate your life and your health in general.
Mm-hmm.
People who are having it repeatedly, if not well managed,
Mm-hmm.
it can complicate to heart diseases.
Okay.
Correct.
Mm-hmm.
It can also lead to other chronic conditions like pressure in
Mhm.
this manner.
Yes.
So we always encourage patients not to sit back at home.
Mm-hmm.
It is good to come out. Let us attend to you, to our facilities, to be able to put you on proper management,
Mm-hmm.
proper treatment, and you'll eventually lead your normal life.
Mm-hmm.
Oh yeah.
Okay, thank you so much. Thank you so much, Dr. And now, I think you've already answered my next question, and it was how, unfortunately, this attack, panic disorder, leads to just affects our daily life, and you've been able to elaborate that. And I think we need to really seek help. But now, let's say there's someone who's out there, and they're currently, like now and present, they are experiencing a panic attack. Let's say that. How can they manage it during that time? If someone is experiencing
Okay.
a panic attack presently.
Correct.
Yes.
The first thing you need to do is just relax where you are. Take a moment and sit down
Mm-hmm.
and just relax and listen to yourself.
Mm-hmm.
Don't continue to feel that whatever you are panicking of or for from
Mm-hmm.
is gonna happen. Sometimes
Yes.
it just
Mm-hmm.
sometimes it's just a matter of flashback.
Yes.
But now that flashback cannot cause any harm to you.
Mm-hmm.
Just relax where you are.
Mm-hmm.
Once you're out of that danger, come to the facility.
Okay.
Yes.
So they should first of all relax
Relax.
wherever they
Breathe
are.
in, breathe out.
Uh-huh.
Breathe in again
Mhm.
and out 3-4 times
Mm-hmm.
and relax. It will disappear.
Mm-hmm.
For after some time it will disappear.
Okay.
Then once you're out of that, kindly come to our facility,
Mm-hmm.
our hospital.
All right.
Just in Kitale here.
Mm-hmm.
We'll give you the address
Mhm.
if Sheila will give you the opportunity.
Okay, we'll see if time will allow. But as we continue the discussion now,
Yeah.
we find that these people who are undergoing such situations, they
Correct.
have families, they
Yeah.
have friends.
Yeah.
How can family and friends support someone who is having or living with a panic disorder without making them feel like they're being
Stigmatized.
stigmatized or they're being judged?
Correct.
Yes.
Thank you. You have answered. One thing that you should not judge them, the way you have said.
Okay.
So don't see them as if these are not normal people,
Mm-hmm.
and of course isolate them
Mm-hmm.
or exclude them from your daily activities. No. The first thing you need to do as a family member is that embrace them, love them,
Mm-hmm.
and when they're in that mood, always help them to relax by giving them conducive environment. In this manner, I'm saying,
Mm-hmm.
don't shout at them, don't speak at them loudly, just encourage them that it's well.
Mm-hmm.
I always say that it is okay not to be okay.
Mm-hmm.
You remember that statement?
Yes, it's okay
It's
to
okay
not to be okay. Mhm.
So when you're not okay, it's not that it's not okay. It is okay, but for just a while.
Mhm.
So as a family member, allow them to relax, and once they have relaxed, give them opportunity to express themselves, what they are feeling. Then take them to the hospital.
Yes.
Assuming it is happening at night,
Mhm.
what will you do at night? Allow them to relax.
Mhm.
Just give them a conducive environment out of danger and let them relax, sleep, wake up tomorrow morning, and visit our facility.
Absolutely.
Yeah.
Oh, thank you
So
so
the
much.
issue is about charging.
Mhm.
Never charge a person who is having panic disorder.
Mhm.
Never discriminate them.
Mhm.
Never stigmatize them.
Mhm.
Always have opportunity to embrace them
Mhm.
and be able to create that friendly environment.
Mhm.
Let them accept that it is okay not to be okay,
Mhm.
but eventually take them to the hospital for treatment.
Absolutely.
Yeah.
And I think you've been able to answer that very well. Thank you so much. And I think all the family members and the friends out there have gotten a deeper understanding on how best to help their family members and friends who are experiencing, unfortunately, a panic attack, or maybe they're having this panic disorder out there. And as we almost wind up this wonderful program, what are some of maybe the myths that are out there? You know, in all this, in all the knowledges we have myths and misconceptions, Dr. Ari. I don't know if you have ever come across a myth in regards to panic disorder.
Yeah.
Yes.
Yeah.
What are those, and maybe how do we debunk them? Because maybe someone will say that this person has a weak personality and something like that. I'm just assuming. Yes.
Correct. Yeah. So yes, we have myths outside there.
Mhm.
Remember, every society
Mm-hmm.
has myths.
Yes.
Yeah. So I've had people talk about people who are having these panic disorders. If they are evil spirit filled
Mm.
people,
Mm-hmm.
they think that you are possessed with evil spirits.
Oh. Mm-hmm.
And others will always say that this is a person mwenye akona kifafa, you know.
Oh, yes. Uh-huh.
So they think that a person is having panic disorder sometimes is a person who is having kifafa. And that's why sometimes actually people confuse between panic disorder
Mm-hmm.
and kifafa per se. Kifafa is
Yes.
epilepsy, by the way.
Yes.
So they also have the myths of saying that this person is being called by ancestors. You see? Ancestors
Really?
are talking to him
Oh,
and
okay.
he's shaking.
Uh-huh.
You get the point?
Okay.
So these myths are not good.
Mm-hmm.
That's why we always create this awareness to demystify them.
Mm-hmm.
Because sometimes people delay to seek proper medication, proper treatment, proper
Mhm.
management, because they assume that
Mhm.
it is not something to be treated. It is something that can just disappear or fade with time, which
Yes.
is not the case. So
Mhm.
we always encourage people not to listen to myths.
Mm-hmm.
It's better you seek medical advice.
Mm-hmm.
Yeah.
Okay. And as we almost still wind up, you know, in the same last but not least, we usually say that and then we go another 1 hour. But when we were taking a short break, there's something quite interesting, and I think our viewers will be also interested into getting an understanding of how do they differentiate a panic disorder and now phobia. Because because we have been talking about fear in present in terms of panic attacks and panic disorder, and we have phobias out there, and that is also something that we will discuss later on. But I think it's okay for us to have that differentiation and also an introduction to it.
Thank you so much.
Yes.
So phobia
Mm-hmm.
is just fear. When you say phobia, just another term to say fear.
Yes.
Now, panic disorder.
Mm-hmm.
It was panic, but now it's a disorder.
Mhm.
So that means it has been you are unable to control it.
Okay.
So panic disorder, it happens unexpectedly.
Mm-hmm.
Phobia can happen expectedly.
Okay.
For example, people who are having phobia for height,
Mm-hmm.
so they cannot go far. There is a certain height a person will reach and tell you, I can't go beyond here. So they have phobia for height.
Uh-huh.
And so it is expected that if I go beyond here, I will have that fear.
Yes.
You get the point?
Mm-hmm.
There are people who just fear certain animals.
Mm-hmm.
Those who fear dogs, those who fear snakes,
Mm-hmm.
and there are also those who fear wild animals.
Okay.
So it's like it's expected fear.
Mm-hmm.
All right?
Yes.
But for panic disorder
Mm-hmm.
is unexpected.
Unexpected. Okay.
You get the point?
Mm-hmm.
So for phobia, it's a short-lived, something that can happen when there is that trigger.
Mm-hmm.
When you are in a presence of a lion that you fear, that fear will come.
Okay.
But when lion is not there, there is no fear.
There's no fear.
So that's phobia.
Mm-hmm.
For panic disorder, it is something happening unexpectedly
Mm-hmm.
without having prior information that is going to happen.
All right.
All right?
Mm-hmm.
You will just be in the house and that fear grips you.
Mm-hmm.
Remember that you are in the vehicle, you got an accident, you
Mm-hmm.
got that fear, shaking, trembling, sweating.
Mm-hmm.
Yep. So that's the
Okay.
difference.
Okay, thank you so much. Thank you so much. And finally, as we wind up this amazing program and our discussion on panic disorder, what message of hope would you like to give someone and maybe family members out there who are having people or are experiencing this panic disorder?
There is hope. Once you have that challenge, come to our facilities. We will treat you and you'll get out of that danger.
Mm-hmm.
So it is treatable condition that should not worry anybody, and it's something that once you face, kindly seek medical advice, not to listen to the myths, those lies in the villages. People
Mhm.
lie, people shade with things that are not existing. Kindly seek medical advice from the nearest facility, hospital, and I'm sure that you'll get the proper treatment. And of course, at the end of it all, you will be healed from it. Yes, in
Yes.
Jesus' name.
Amen. Amen. Indeed, indeed. Thank you so much, Dr. Arif, for
Probably
that.
before you go, I know
Yes.
some people may ask, where do we go to?
Mm-hmm.
It's important to let our viewers know that Afya Care Foundation
Mhm.
has specialists. These specialists are psychologists, are medical officers, clinicians, nurses,
Mm-hmm.
and of course, we also have those who offer psychotherapy services.
Yes.
So Afya Care Foundation has a website,
Mhm.
www.afyacarefoundation.com,
Mm-hmm.
and we also have our line, Safaricom line,
Okay.
0741 673 154.
Mm-hmm.
Yeah, that's our line. If you are affected, dial that number or visit our website. The
Mhm.
also address, email is there. You can always reach us, and we'll always be willing and ready to assist you.
Absolutely.
Yes.
Thank you so much for that. And I think our viewers will be able to reach out to Afya Care for more assistance and help. I hope wherever you're watching us from, you have been blessed and you've gotten a deeper understanding of basically what panic disorder is all about.